at the very early stages right now when it comes to looking at how digitalization is helping us. I think telemedicine has been the biggest jump that we are seeing. But going forward, with ABMD, all these platforms that are coming forward, we will be able to look at patient care maybe from one perspective. But that is still long ways, because the biggest gap is how do we collect our data? How do we ensure that data is private? How do we ensure that data is not misused in any way? So I think when we look at patient centricity, we all are garnered how do we help our patients in the best possible way. But a step at a time, I think everybody needs to get together and come up with a solution that can help our patients without affecting their privacy. At the same time, we use the data in the right way to make the right algorithms that can really help diagnose people in time and possibly, change the whole way how healthcare is done. So, with telemedicine, the biggest advantage we are seeing is the accessibility to healthcare. In India, one of the biggest problems is, which we don't realize living in urban cities, is the accessibility to healthcare. People have to travel for hours and hours just to find a decent doctor. So with the help of telemedicine, we're increasing accessibility, affordability. People travel for hours, they spend so much money for a half an hour appointment, for a 20-minute appointment with a doctor. So I think that is going to change everything. Now let's say, when you look at a person from a telemedicine perspective, let's say they get diagnosed with a condition now that needs further care from a super specialist, then that journey can be made. So when we look at these kind of, situations, we see how beneficial it can be. Let's also look at another perspective. 𝐂𝐤𝐿 has come up with this TB screening tool. Now, looking at X-rays, just looking at a low radiation X-ray, they're able to figure out who might be having TB. We know how rampant TB is. Nobody knows how many people are suffering from it. So just imagine the early diagnosis of this condition, how we can help it from spreading to thousands of other people when it's treated in time. So if it's utilized in the best way, I think going forward, AI can be a big boon. Telemedicine has already proven how beneficial it can be in bringing accessibility and affordability. And I'm sure as we go forward, we'll see this help, all our patients even more. It was absolutely wonderful. We had a very interesting panel discussion, and I think it's an honor to be with such, stalwarts in the industry. And it was wonderfully moderated. And I think it brought out a lot of important points. Not that, of course, the future is AI, the future is digitalization, but how do we do it is the biggest thing. So I think that's the biggest takeaway.